perform CPR on an adult, first check for danger. Are you or the casualty in any immediate danger? If yes, then remove the danger. But if that's not possible, move the casualty. Now try to get a response by kneeling next to the person and squeezing their shoulders.
Open your eyes.
Hold their hand and ask them to squeeze if they can hear you.
Squeeze my hand if you can hear me.
If there's no response, send for help. Call for an ambulance on 000, or if another person's available, ask them to do it.
Call an ambulance.
Open the airway by checking the person's mouth and removing any obstructions with a finger sweep. Once the mouth is clear, tilt the head back to open the airway. Look, listen and feel for any breathing. If they're breathing, gently roll them onto their side into the recovery position. But if you can't detect normal breathing, then start CPR. 30 compressions of the chest, followed by 2 breaths. Here's how. Begin by kneeling next to the person's torso. Place the heel of one hand over their lower sternum, with your other hand on top. Lock your fingers and lean over so your arms are straight. Push the chest down by 1/3, about 4 to 5 centimetres. Now do 30 compressions in time with the flashing indicator on your screen. Count out each compression until you reach 30. We'll wait while you do that. Reached 30? Time for the 2 breaths. Tilt the head back, lift the chin, block the nose. Completely cover their mouth with yours and breathe out. After each breath, look for the rise and fall of the chest. That's all the breath you need, enough to lift the chest. Continue CPR at 30 compressions to 2 breaths until the person responds, or normal breathing returns, or the paramedics are ready to take over. This is hard work and you'll soon tire, so if there are other people nearby, get them ready to take over.
Can you give me a hand?
As you continue to provide 2 breaths, make sure the head is tilted back and that the chest rises and falls each time. If the chest doesn't rise, it may mean that the head is not tilted back enough, or that the airway is blocked. If the person is still unresponsive and not breathing normally, apply a defibrillator if one is available. Follow the prompts of the defibrillator and be prepared to continue CPR if required and as directed.
Peel 1 white pad from the grey case.
Otherwise, keep doing CPR until help arrives. When the ambulance arrives, the paramedics need to get to the casualty as quickly as possible, so have someone ready to meet the ambulance.